All right, so you're imagining like a doctor's or nurse's office, talking to them about like your condition, and then you look over to them and they're just looking at their computer screen, not paying attention. That's kind of what I want to talk about today, as to why practitioners, specifically physical therapists, should have good communication skills. A physical therapist, per the U.S. Department of Labor, is a practitioner that helps the ill or injured manage their pain and to help them move freely or close to where they were before their injury. I'm knowledgeable in this subject because I'm currently going to school to become a PTA, which is a physical therapist assistant, and I'm also working as a technician at a physical therapy clinic. Yeah, so there's like just the main points I kind of want to cover today is why a physical therapist should have good nonverbal and verbal communication skills, why a physical therapist should be knowledgeable in their subject matter and be able to describe why certain treatments are important to clients, as well as why a physical therapist should have good leadership and communication skills towards technicians and PTAs. Firstly, with nonverbal communication, so MedPro Group did a study that showed that most of our daily communication is actually done nonverbally, which is like just like your general like mannerisms and whatnot. For example, your like posture. So like if a physical therapist is like closed off like or gated like this, the client's not going to want to open up to them more and describe their condition more. Rather than if you have like open arms, they're going to want to explain fully what their condition is. Also showing interest with your patient. So like giving them eye contact as well as like nodding while they're talking, so that you're showing them that you are paying attention and that you are listening to them and that they feel comfortable. And then lastly, make sure to stay on their level. So if you have a client seated, make sure to sit down with them rather than standing over them and like towering them so you don't belittle them. And then with verbal communication, Fox Rehab did a study that showed that practitioners tend to interrupt clients after 12 seconds. Obviously that's a negative. You don't want to do that because even after those 12 seconds, a client can give you more detail as to why they're feeling like certain pain or like what their condition is, and then you're able to better help them through that. Also demonstrating active listening skills like our book says, such as mirroring, withholding judgment, as well as like elaboration. What I mean by mirroring is that like just talking back to the client. So like, so for example, if the client says like, oh, I walked my dog at the park today, then you can say, oh, how was the park? Stuff like that, just to show them that you are actually listening to them. As for physical therapists being knowledgeable in their subject matter, obviously they go to school for that, so they understand it, but they need to communicate that to the client. So if they're doing like or they tell them to do like certain exercises or stretches at home, they should tell them why they need to do that and why it's beneficial to them. Also being astute. So what that means is like, say like just point out progress points to the client. So for example, at the physical therapy clinic I work at right now, we get a lot of hand patients. So say at the start they're able to like bend their hand like 75 degrees, but like a week later they're able to bend it like 90 degrees. So you need to communicate that to the client so that they're able to see their progress and that they're going to want to keep coming to therapy or to keep doing their exercises and stretches at home. And then lastly, when it comes to physical therapists, like leadership skills and communication skills towards technicians and PTAs, I think good leadership for a physical therapist is directive leadership. So just directly telling me what to do. So, because I'm not licensed to do anything. So if they tell me, oh, go through like this treatment log with a patient or go through certain exercises with them, rather than just like handing me it and saying like, go help them out. Like that's not as helpful rather than saying like specifically what exercises I need to do. And then that kind of leads me to the next point with other communication. So a lot of the times those treatment logs will just have abbreviations for exercise names, such as SLR or shoulder ER and shoulder IR, which at first I had to go back to the therapist, interrupt them working with another client and ask them what are these exercises or what are these stretches. And then I had to interrupt the other client's treatment time, which I understand what they are now. It is single leg raise, shoulder internal rotation, and shoulder external rotation. But then in the conclusion, just to review the main points again, why a physical therapist should have good nonverbal and verbal communication skills, why they need to fully understand their treatments and why they're giving them to the client, as well as having good leadership skills and communication skills towards technicians and PTAs. But I hope what I taught you today is helpful to know about physical therapists, as well as like why communication is important for the success of the therapist as well as the patient.